Hello and welcome to another episode of the Kingswell Conversations. Conversations with heart that are shaping the future of foster care and adoption. And I'm absolutely thrilled once more to be back with Richard Kingswell, CEO of FosterVA and Extra Special Parents in Virginia. Richard, thank you so much for joining me for episode 12 of the Kingswell Conversations. How are you today?
Very well. Can't believe I've got to number 12. Good morning.
I know. And haven't we just been talking that we've enjoyed it so much, we're going to keep it going?
We're going to try and find some new topics. So
we
if you've got anything you want to see or hear, just put it in the comments and we'll see if we can do a video for you.
Oh, that was a great idea. That is a great idea. So today then, we feel like we've covered like a whole plethora of this topic. So we started learning about you, and then we learned more about FosterVA and Extra Special Parents, more about the type of parents. We've done some myth busting. We've had a little soapbox moment. And now, because it's like our last one in this series of 12 that we put together in this particular series, we now want to kind of just look a little bit to the future of what lies ahead. So what I'm going to be doing, is okay with you, is I'm going to break this down into 4 distinct sections, so 4 distinct parts. So 4 questions.
Okay.
And I'd really, really value your thoughts and opinions on what about the future of foster care and adoption. So are you ready?
Let's see how I do.
All right. So question 1. So I have them written down. Where do you see foster care heading in the next 5 to 10 years? So what trends, what do you see based on what's happened, what's going on now? Where do you see it all heading in 5 to 10 years?
Well, the federal government has made a big shift to really support kinship care. And kinship care is a family member or a friend that will help with a child. So they've already got a direct connection with the family. And so the bio family may be struggling with a financial situation, a substance abuse, something like that, that's brought them to the heads up of the social services. And so we've seen by research that kinship care, keeping within your family, if you've got enough support, can really make a huge impact and make a difference in the success and the outcomes, and keeping children out of traditional foster care and therapeutic foster care. And so keeping them in the family. So that's the main push I see in the next 5 to 10 years, is to reassure families that they can take on a child that they may have never even seen. It may be an aunt, an uncle they haven't seen for years. But social services, with the power of the internet, have hunted you down and made a phone call and said, we don't really want to bring this child into foster care. We'd rather keep them in the family. Will you put your hand up? And so that change in the direction from having a fully trained person to someone that we will train after you have the child is probably the biggest transition that you'll see in the next 5 years. After that, I think it's just reinforcing all the steps with evidence-based research. So having outcomes about what we've been doing for 20 years and proving we can duplicate it. And if we can duplicate it, then someone else can take on the model, and then finding the best model for us to follow as a country. And so I think that would be the 10-year plan.
Okay. Now, when we talk about kinship care, and I know that's a whole topic in itself that maybe we'll cover in the future, but just for people, obviously, we know that means the child stays within the family unit. It could be a distant relative, but there is a familial connection for that child.
Correct.
When a child, just throwing it out there, really is a really important question. When a child goes to a family member, is that still a fostering arrangement? Are they fostering that child in the interim, or are they just taking the child into their family that then becomes an adoptive process? How does it kind of work? Can we just touch on that for people that aren't fully aware of a little bit more about how kinship care works?
Yeah, so there's a formal and informal kinship care. Okay. So informal is when you see your friend next door get sick, go into the hospital and say, I'll look after your child. Okay. Nobody's involved, and it's just you putting your hand up and helping out, which is great for a short period. I think many parents have a neighbor or someone that you can drop the kids off onto, a friend's network and things like that. And that can last maybe a long weekend or something like that if there's a surgery or you broken your foot and have to stay in and you're a single parent.
Yeah.
Those would be the most likely for informal kinship care, where you're just using your network and helping out. Or a grandparent says, look, you need to go into a facility and I've got a spare room and your child can come in, and it's my grandchild or something like that. And they just do it because of the love of the family. But there is barriers, and the barriers are usually more like financial resources, resources around feeding an extra mouth that you weren't expecting to be feeding at 75 years old, or you're on a fixed income, or if you're on so you've got 2 kids already feeding, and you're living paycheck to paycheck, and another 1 or 2 kids, even more sometimes, will turn up. So that's informal can start stretching, and then you can go to Department of Social Services and say, I need some assistance. Yeah. And they say, well, we don't want to bring this child into foster care and therapeutic foster care. So what we'll do is we'll support you with strategies, financial relief, so that you can not put your family under strain, but still keep the kin there. So they're the 2 differences.
Okay, that's great. That's great. Thank you for that. So kinship care is something I know that we spoke about in the past away from here. I know that you've said before that that's really a direction, and that sounds, that's really positive, and then hopefully that will be something.
It is. It's been a very big change for the government, and the federal government is the ones that are steering this. So this is why I know the 5 to 10 year plan is going to be effective, and it will work, because it's if you want federal dollars to support your community, you have to follow their rules, and their rules is that kinship care, they want to be a major part of foster care. So everybody's going to be following this. And the challenge is with 50 states in the US that everybody has their own interpretation, like everybody's interpretation of the law. I think it sounds like this. And so every state...
There will be some variations.
There'll be some variations across 50 states and 500,000 children in foster care. So the differences will be which evidence-based plan will you use? The government says these ones meet muster. These are the ones that are the quality programs. And as such, they work out very well for being the best. And this one's okay, and this one's... And so every state will make their decision about which model they want to follow, depending on resources and their belief and core values, because everything like that will depend on the politicians that are running the system and telling us what to do in our state legislature.
All right, brilliant. Thank you. So you've talked about what you know that the federal government want. Now I want to ask, what would you, Richard Kingswell, like to see happening within the world of foster care and adoption over the next 5 to 10 years? What would you like to see?
Well, mine's a bit bigger of a vision, I think. Mine is like world peace sort of thing.
I was going to say, is it a world peace one at the moment?
It is. That I don't think we're going to get there, but if you don't put a vision out there, it's very challenging. That's working out how we can give resources to bio parents well before the crisis happens. So when we see them starting on the walk of crisis, so that we put in areas that we can support earlier on. The problem is with any society, those measures cost. And a lot of society at this stage in our community is pull your bootstraps up and get on with it. And the safety net is abused by some, and they don't want to work and they don't want that. And they're the ones that get the news. But the ones that just need a little hand holding just for a short crisis, if it's a mental health crisis, if it's a financial crisis, if it's a marital crisis, that we could step in earlier and really help out before social services and the school systems and the courts all say, Houston, we have a problem.
And so
prevention. The prevention side, much earlier, spotting the children that need help, that are getting hungry, not dressed well, and not being kept well. And you start seeing the red flags, and people will wait a little bit longer because they say, parents can get it together. And then all of a sudden there's a crisis. They miss 3 or 4 days of school, and then things start escalating. And it's very hard to get off the escalator, as you know, when you're in an airport sort of thing. It's very hard. As soon as that escalator starts moving and you're on it and you're trying to get backpedaling out of it is really, really hard. So early intervention to prevent that. So hopefully we'll get there. The kinship care is a great start. And so we're saying we can support the families, but now spotting it a bit earlier would be the big vision.
Brilliant. Thank you for that. And that makes complete sense, doesn't it? On all levels, prevention is always the better policy in so many different ways.
And it's also cheaper. It doesn't take much. So you can learn that from other countries that have very sort of micro loan situations and things like that, that make a huge difference to a community in a moment of crisis, a moment of need, just a micro support from the community, not long term, just to get them through this crisis, is where we need to go. So that would be the next stage that I would like to see, is that we've got the family, we've got great foster care, we've got great therapeutic foster care, we've got great adoption, all need great people, but early intervention, but that was going to be a financial strain on the country, and world peace.
World peace on top.
On top, yeah.
On top. So as the CEO of an agency, when you look ahead at the next 5 to 10 years, what kind of things are you looking ahead to implement or modify or adapt as an agency CEO, and as the growth of your agency, with Extra Special Parents? What are you looking at when you look at a 5 and 10 year vision plan of how you need to modify or adapt the way you do things now for the future?
So I've set that vision for the company already, and I believe we're a good company, and I want to be a great company. And making that transition to great is a challenge. Very few companies make it to great. Lots of companies make it to good. More make it to okay. We're a good company, and we try very hard at what we do, but I want to be a great company. And so I think documenting research and starting to become our own Extra Special Parents evidence-based model is where we need to go. But that takes a lot of resources to do that. It also takes lots of ideas, and then you have to document, and lots of training. So it's a huge investment that we'll be making over the next 5 to 10 years to make us great. And so that transition is understanding where the country's going, where research is going, and then copying it, building upon it, and then make it your own. And so that's my journey over the next 5 to 10 years, is to make us a great therapeutic foster care company, a great kinship care support organization, advocates for that, because I do believe family comes first in this journey. And that's our mission, is to get kids back to their biological families, and then our foster families and adoptive families. So just proving it is my next journey, is proving that we're a good company, but now we're evidence-based, which will make us a great company.
Fantastic. And so then hopefully you will have your own sort of signature method of the way you work, that you've taken from what's already out there, but evolved it and made it greater.
Correct, yes. And I think when I get to great and people start copying me, I've made my dream.
Measure of success then, isn't it?
When they say it's a great compliment.
Imitation, isn't it? Imitation is the greatest form of flattery. So
yes. That's where I want to go.
Yeah,
that's the mission.
Fantastic. And when you now think about, obviously we've talked about what's going on in the government, we've talked about what's changes and modifications and things you're going to do within the company. What can people outside do? So when it comes to the community, how can the community make a role or play a role in all of these amazing ideas and plans and things that you believe that should be happening in the next 5 to 10 years? What role can the community play in making these circumstances better?
Well, the politicians that give us direction of where we're going in Virginia get voted in every 2 years.
Okay.
Tell them that children are important. Tell them that family is important. Get them to know that this is a priority for your vote. And if you vote for children and you vote for community and family, they will do that. They want a job. They want their free benefits, their healthcare, their wages. They also politicians chose to be service to our community. So they can get in their little bubble because people protect them from riffraff like me and say, please, please, please. But more voices. It doesn't take a politician in our community, only takes a few thousand votes in the primary to be elected. That's not many people saying children first.
Yeah.
So advocate for the child, your neighbor, advocate for the direction of good quality care, and advocate for the workers that do for this. The greatest success in our business is ratio driven. If we have more people working with less kids, we will do a better job. If you have bad ratios, you do a bad job. So that costs tax dollars. So someone has to put kids first from a financial perspective. And so I really do want children to come first, families to come first, but we have to be paid for by ratios. We've got a legal ratio and it works, and it keeps the kids safe. We don't have that many bad examples over the year of something going wrong in the system from our perspective. From a national perspective, you don't hear that many bad stories about a bad foster parent getting through. That's because the ratios work. But having a okay ratio, having a good ratio, and having a great ratio makes a huge difference in the outcomes. And so that's an investment by politicians to say children are worth it.
And it's true, really, because it doesn't matter where you are in the world. When you look at the percentages of people who actually use their vote,
right,
the percentage of people who actually vote for whatever, whether it's a government vote or even a local election, the percentages of people who could vote versus who actually do use that vote or use that voice is always tiny. There's a lot of people who don't ever use that vote or use the voice they've been given to make a change.
Right. And I think that the part that a lot of people miss out on, and I've been a sinner in this as well, is the primary system. When you're electing who's going to represent you from a party, so is it a Democrat, a Republican, or independent? At that primary election, it's a tiny percentage of people that will vote to make sure they pick the person they want. That's when you have the power.
Every vote matters, really, then, doesn't it?
In that primary, every vote matters. When you get to a national or things like that, you feel like I'm one in 50, 60 million people voting in your local state and things like that. And you feel, it's not going to make any difference, I don't turn up. But from a primary, if you turn up, you may be one of 2,000, and that is the difference. And especially if it's a good candidate and an okay candidate, if you can get the message across that you want child first, and you turn up and tell them that, they'll listen because they know it turns up.
Brilliant. And there you go. So people watching this now, use your vote, use your voice, and let those people know that are in the power or are trying to get to a place of power or influence that it's child first.
Yes. When they're trying to get there, they listen really good. When they've got there, they're too protected by the pollsters and other things like that. And
I kind of sometimes feel like I got it already. I don't need to listen so much now because I got what I wanted.
I've made it to the ivory tower, and I'm protected by my knights around me, sort of thing. But those primaries come around every 2 years. Every 2 years, those primaries come around that make the real impact of what we're doing in Virginia. And the senators are the federal ones, and they come around every 6 years. So that's a lot more challenging to get them to change their direction because they are just looking after the big picture. And when you're a sitting senator, you're pretty much guaranteed to get your job back in America at the moment. But those people that make the legislation on the ground, the ones that impact me, extra special parents, and every other agency, they're every 2 years. You have the power.
And I think it's worth mentioning as well is, aside from just having a vote, maybe if you're somebody also within a community that actually feels very strongly about this stuff, that actually, why don't you put yourself forward for some of these elections as well, to actually not just vote for somebody else? Maybe, you know, deep down, you're thinking, I feel so strongly about this, but I don't necessarily have the courage or something to put myself forward to be the voice and actually be the person. Is maybe this is something you should do. Is actually,
if it's your mission and you feel that children first is the mission that you want to put front and center, so you're not so worried about the tax of a corporation in Silicon Valley, then that's not your thing. But if you want to be an advocate for children, be the advocate for children. You need a couple of thousand votes to make it to the front of the ticket.
Fantastic. Well, thank you so much, Richard. That was amazing. So we've talked a lot about the future. So interesting things ahead though, huh?
I'm sure we can pad it on another one if you need to, sort of thing. I think I pushed enough buttons around that we can have a conversation later on. But thank you for these 12. It's been fabulous.
But really interesting today, though, to look ahead, and the kinship stuff is really interesting, isn't it? Because that's something that's very important. You know, regardless of any situation, when the parameters are correct, kinship care is always the way forward. So thank you so much.
I think that'd be a 30-minute interview if you try to do that one, because I think that is such a vast array of new direction for our communities that we can have a real good in-depth one. So maybe we'll put that on the radar.
Fantastic. And thank you so much for tuning in and listening to us over the last 12 weeks. We are going to be back with more Kingswell Conversations in the future, but we really, really appreciate you coming along and joining us for what we've done so far. We hope that you found them really, really informative. If you would like to learn more, or if you would like to connect with Richard and the team at FosterVA or Extra Special Parents, you can actually grab Richard's free 45-page guide. It's such a comprehensive guide, and it's actually the comprehensive guide to foster and adoption in Virginia, written by Richard Kingswell himself, which has all the information you need if fostering or adoption is something that you're interested in and you're within Virginia. You can pick that up at www.fosterva.org. If you're watching this and you're thinking this is now the time where I just want to ask some questions about whether the fostering journey could be something that's right for me and my family, please reach out to the team at Extra Special Parents. You can connect with them at www.espva.org. And if you would like to connect with the big man here himself, you will find him on LinkedIn at Richard Kingswell. Richard, thank you so much. Really enjoyed doing this, and let's do it again soon.
Sounds fabulous. Have a great day.
Take care now, everyone. Bye-bye.